Perfect, thank you. And it is so nice to see you, Celia, in Canada, because we did meet a couple of years ago in Australia, so small world. And thank you everyone for joining this presentation today. So as Celia mentioned, I'll be talking about sort of my Health System Impact Fellowship research, which is looking at exploring the implementation of learning health systems in tertiary care. So first, I'd like to begin by acknowledging that I'm presenting from Mi'kmaq, which is the ancestral and unceded territory of the Mi'kmaq people. This territory is governed by the Treaties of Peace and Friendship. Today in my presentation, I'll be sharing with you an overview of learning health systems, including some of the frameworks and theories and characteristics of learning health systems. Then I'll talk about some of the gaps in the learning health system research. Then I'm going to share with you some of my own fellowship work, which is related to learning health systems. So that's sort of two phases of my fellowship project that I'll be sharing, and then talk about next steps and have a discussion at the end. So for any of you that are unfamiliar with the term learning health system, there's been a few definitions out there in the literature, but one of the earliest ones and the one that's cited most often comes from the Institute of Medicine from 2007, where they had a working group that kind of established this formal definition of what a learning health system is. And so they define a learning health system as a system in which science, informatics, incentives, and culture are aligned for continuous improvement and innovation, with best practices seamlessly embedded in the delivery process, with new knowledge captured as a byproduct of the delivery experience. And a bit more recently, in 2012, the Agency for Healthcare Research and Quality sort of expanded on this definition, and they define a learning health system as one in which internal data and experience are systematically integrated with external evidence, and that knowledge is put into practice. As a result, patients get higher quality, safer, more efficient care, and healthcare delivery organizations become better places to work. So these two definitions are quite similar. There's a lot of overlap between the concepts, but you might notice in the Agency for Healthcare Research and Quality, their definition, they talk about patients as being part of the health system, which is a really important part that should be acknowledged as we're kind of moving forward with the learning health system terminology. And their definition also brings into play kind of the purpose of learning health systems, which is really to improve patient care, to get higher quality, safer, more efficient care. And so this idea of learning health systems can really be implemented or applied in lots of different types of health systems. So a learning health system could be implemented at a department or unit level. So for example, the Learn from Every Patient learning health system is a learning health system that was implemented in one particular hospital for children with cerebral palsy. So that was a very specific sort of smaller scale learning health system. But learning health systems could also be implemented at broader levels. So the Evidence Now is an example of a learning health system in the US, where they've implemented this across multiple different primary care practices across the United States. A learning health system could also be at a provincial or statewide level. So in Canada, most of the provinces are sort of working towards a provincial learning health system. And then there could also be a learning health system at the national level. So the Swiss learning health system is currently being implemented in Switzerland as sort of a national level learning health system. And there's also been a lot of research and reviews conducted to really synthesize what is a learning health system. So what components or characteristics should be included in a learning health system. So these are just some of those examples of those reviews that are out there. So there was a scoping review, which was conducted by Zarinsky and others, where they took all of the literature talking about learning health systems, and they included over 200 learning health system resources in their paper. Another resource or review that is really important to be familiar with is by John Lavis and others. So they looked at learning health systems across Canada, and they kind of came up with this list of characteristics and components that should be included in a learning health system. And then there's Dr. Munir and others who conducted a scoping review to determine a framework for learning health systems. And so there's a lot of evidence out there kind of exploring and synthesizing what is a learning health system and what should be included in a learning health system. So with all of this evidence, there's a few different lists of characteristics or components that should be incorporated into a learning health system, but they essentially share a lot of the same features. So this list here is from John Lavis and others' paper that I just shared with you, and they sort of identified 4 key components of learning health systems, and within these, there's 7 key characteristics that they identified as being part of a learning health system. So in their research, they determined that a learning health system should be data and evidence driven, it should be patient-centered, it should be system supported, and culture and competency enabled. And on the right, this is a sort of visualization of the learning health system from the Agency of Healthcare Research and Quality. And as you can see, it really sort of shows this idea of bringing research and evidence and data into practice in this cyclical manner with continuous learning and improvement. But what I really like about this particular framework or figure for a learning health system is that the patient and the healthcare provider are at the center. So not only are we bringing evidence into practice to improve patient care, but patients are also providing us with sources of evidence in the shape of their experience, patient outcome data, as well as healthcare providers are offering their experiences and perspectives on how we can improve care. And these are brought into the learning health system as sources of evidence and data to continue to inform and improve practice over time. So we have a lot of evidence out there sort of explaining what a learning health system is and what those core features should be, what it should look like. But we don't have as much information out there telling us how do we actually implement a learning health system? So how do we apply these components in practice? And so that's sort of where my current program of research is focused on, is trying to help us move the science forward and try to better understand how we can actually take those learning health system concepts and start putting them into practice. So I'll be talking about kind of 3 ways that I'm doing that through my current fellowship program. And the first is the Health System Impact Fellowship, which is a program through CIHR that provides trainees and fellows who are involved in health services and policy research to really apply their skills in a health system to address critical challenges. So really the Health System Impact Fellowship is part of that learning health system as it's bringing that evidence into practice. So having that research lens directly in the healthcare system as a way to kind of bridge that gap. And for my fellowship work, I'm specifically using a learning health system lens in my projects in my fellowship. So it's sort of being a fellow is kind of helping to move that learning health system idea forward, but then my work is also focused on this concept of learning health systems. And so the first phase research that I'll be sharing with you is a review that we conducted on the implementation of learning health systems. So the purpose of this review is sort of, as I mentioned, we have a lot of evidence telling us sort of what should be in a learning health system, what it should look like, but we don't know how to implement it. So the aim of this review was to synthesize the evidence related to the implementation or the evaluation of learning health systems across different healthcare settings. So to do this, we conducted a mixed methods review, and we used the PICO format, which stands for Population, Phenomenon of Interest, and Context, to guide our inclusion and exclusion criteria. So we were essentially looking for any studies that talked about learning health systems. So this could be learning health systems, learning healthcare system, rapid learning system, learning health network. And we also looked for studies that talked about implementation. And they may or may not have included outcome data as part of their study. And we were looking at any kind of healthcare settings. We were interested in tertiary care settings, primary care, community health, as long as there was a healthcare setting or system component to the study. And we also included qualitative, quantitative, and mixed methods study designs. And we also conducted a gray literature search as well. And if anyone's interested, we have published the protocol for a review just recently in September. So feel free to have a look at that to get a better sense of the methods that we used. And in this review, we were interested in sort of understanding what researchers were describing when they talked about their learning health system that they implemented. So in the synthesis of our review, we used Lavis's 7 characteristics of a learning health system to categorize studies to see how many of those 7 characteristics they discussed, and if there were any kind of patterns in terms of gaps in those learning health system characteristics. We also used the ERIC taxonomy of implementation strategies in order to identify what implementation strategies were used in each of the studies when they talked about how they implemented their learning health system. We also applied Tierney's list of 10 implementation measures and Allen's list of learning health system outcomes to, again, just kind of categorize and understand what researchers were reporting and how they were implementing their learning health systems. So we found a total of, or over 5,000 studies that were identified in the peer-reviewed database search. And we found another few thousand studies in our gray literature search, which we screened through to include 35 papers total, which represented 31 unique learning health systems. And these in type of system and population. So some studies were looking at a pediatric population. One study was looking at the deprescribing of medication in the emergency department for older adults. Another study was specific to neonatal population, and other studies were more general. And we also had a variety of healthcare systems. So some studies implemented their learning health system at an individual unit within a hospital or the entire hospital or primary care setting. Other learning health systems were implemented at multiple different institutions. And of the 35 papers that were included, 20 were conducted in the US and majority were published in the last 4 years. So really since 2019 is where we're seeing most of this literature, which just goes to show how this concept of learning health systems is really moving forward quickly. So in terms of the results, when we synthesized each of these studies and looked at how they described their learning health system, we identified that digital data capture was the most commonly reported learning health system. So out of those 7 learning health system characteristics, digital data capture came up most often. And patient engagement and culture of rapid learning improvement were noted least common or least often across the studies. So this was a really interesting finding. And I just wanted to share some of the examples of how this was reported in the study. So on this table here, you can see an example of patient engagement from Pareto and others. They described how patients and families were engaged in meetings to actually build their learning health system. Other studies talked about patient engagement in the sense of patient data was used to inform practice change, so kind of varied across the studies. And in terms of that digital data capture, one example from Krung and others, they talked about their learning health system, which was called Transform, and how they used clinical research data in their electronic health record. And that's how they were capturing data as part of their learning health system. And then another example of one of those 7 characteristics is having aligned governance. An example of this from Hayes was that they talked about how they have procedures in place to govern the data and make sure that it's used appropriately across the different health centers. But again, aligned governance was something that was reported slightly differently across studies. So sometimes they maybe talked about how they had the financial capacity to support learning health systems and ongoing learning, or having those kind of leaders in place to ensure that this concept of learning health systems was implemented across the health setting. And when we looked at the different implementation strategies across studies, we also noted that some were reported more often than others. So changing record systems was most often reported across studies, which isn't completely, isn't a huge surprise, I guess, because in a learning health system, being able to capture data is a really important part of a learning health system. So it makes sense that people were changing those data collection or record keeping systems as a way to actually implement their learning health system. An example of this from Lowe's was that they created templates embedded in their electronic health record in order to help collect data from patients. Another implementation strategy that was often reported was facilitating the relay of clinical data to providers. So an example of that is from Floyd. So they had reports requested to help develop clinical guidance and identify research needs. We also synthesized all the different patient outcome data that if it was reported in studies. So in the quantitative studies, a lot of this patient outcome data was along the lines of, after they implemented their learning health system, they saw a decreased length of stay. Another example was one study found they had a faster time between their diagnosis to referral to treatment for patients after they implemented their learning health system. And when we looked at Allen's list of learning health system outcomes, a few of these also were reported more often. So 2 of these that were common were the systematic adoption of evidence-based practice and knowledge to action latency. And then also looking at Tierney's list of implementation measures, we noted some that were more often reported in studies, so adoption, penetration, and reach. So some of the key takeaways from this work, and I should mention that we're still in the synthesis phase where we're integrating the qualitative and quantitative data to kind of identify those key findings across studies. But some of the early takeaways that I can share are that we have seen some gaps in what is reported in studies in terms of those learning health system characteristics. So as I mentioned, patient engagement and culture and competencies were not reported as often as some of the other learning health system characteristics. So this is maybe something to explore in future research, is really focusing on that patient engagement piece, because we know that's such an important part of a learning health system. We want to make sure that we're actually doing that when we're implementing learning health systems in other healthcare settings. And then having these implementation strategies that were identified as being used most often can be a helpful starting point for researchers who are looking to implement a learning health system. So hopefully using some of those examples as a guide to start implementing something at their own site. And then we, in the studies that did report on the outcome of implementing their learning health system, they were mostly related to patient outcomes. Some studies talked about the cost-related outcomes, but there really wasn't a lot reported on the wider population outcomes, provider outcomes, or equity. So I think these are also things that we should be looking at as we conduct more learning health system research. And I think overall, we really need to be looking at the evaluation side of learning health systems. So some studies talked about outcomes as a result of implementing their learning health system, but it wasn't reported in all studies. And I think that that's really important information to capture. So for future learning health system research, I think we should be really trying to understand and evaluate how that learning health system has impacted all these different outcomes. And so following on from that first phase of my program of research, the next step that we're working towards is trying to now actually implement some strategies in practice at the IWK Health Centre. So the IWK Health Centre is a women and children's hospital in Nova Scotia that serves the 3 maritime provinces. So they serve patients from Nova Scotia, New Brunswick, and PEI. And so part of their, or one of the programs that they have across the hospital is that they have a patient safety program where they can identify, address, and prevent safety events that take place across the organization. And they have different levels of these safety events. Some are more serious safety events, some result in no harm, and then others are more moderate level safety events. So we want to understand and kind of use the patient safety program at the IWK as a case study or a pilot test to kind of see how their patient safety program aligns or doesn't align with a learning health system. Because we really want to start to implement a learning health system and kind of transition to that idea and use the patient safety program as an example of how to do this. So in that patient safety program, so as I mentioned, they're looking at all the safety events that take place across the health center. And to do this, they have dedicated staff, so patient safety consultants who actually review all of the safety events that take place. And then they follow up with teams to kind of figure out what happened, what went wrong, and then they make recommendations to address that issue or prevent future similar issues from happening. There's also safety coaches who are trained across the organization who are frontline staff that are kind of safety ambassadors who their role is really to just look out for potential harm in their day-to-day practice and try to prevent harm from happening. There's also the incident reporting system. So this is a database where all of these safety events are reported, and then the patient safety consultants review those and work through figuring out what happened in that safety event. And so they do have different processes in place for those corrective action plans. So if the safety event is a more serious event, they'll do what's called a root cause analysis to really figure out the root cause of why that safety event took place. But if it's a moderate level safety event or a no harm event, there's different processes in place to address that safety event. And so really the idea with this phase of work is to use that patient safety program and look at all the components of it. So their incident reporting system, they have their safety coaches, leadership who is on board with this idea of a learning health system. There's different patient opportunities for patient engagement. But what we really want to understand is, how does the patient safety program align with these learning health system features? So Are patients engaged in the patient safety program? Are they using evidence and data to inform practice? How does the culture support or inhibit patient safety? And how do system structures support or inhibit the safety program? So these components of a learning system, we want to really understand whether or not the patient safety program aligns with those learning health system components or features. So to do this, we're conducting two different studies. The first is that we're looking at current recommendations for moderate level safety events to understand how evidence is being used in practice. And then the second study is going to be a broader analysis of the current safety program. So all of those components of the safety program to understand whether or not it aligns with a learning health system framework. So with the first study, so we're looking at understanding the recommendations that are being made for moderate level safety events. So those are safety events that take place where maybe there was some harm to patients, or maybe there was no harm, but it raised a serious underlying issue that needs to be addressed to prevent future serious safety events from happening. And so to do that, we used the behavior change wheel to look at these moderate level safety events. And we first used the COMBI and the TDF, which is part of the behavior change wheel, to understand some of the underlying behaviors that maybe led to that safety event in the first place. And then we use the intervention functions, which is part of the behavior change wheel, to understand the recommendations that were being made to address those safety events. And then we looked at this together to really see if we were addressing certain behaviors with interventions or recommendations that would be effective. So using the behavior change wheel, we were able to sort of map this out to get a sense of, were we really using evidence to inform those actions, or were we just sort of trying things out of the blue, hoping that it would work. And so this study, we recently completed this evaluation, and so I just have some really brief results to share. But essentially, when we looked at these moderate level safety events, we found some common sources of behavior were noted. So some behavioral issues happen more often than others. So that included memory, attention, and decision processes, as well as environmental context. And then when we looked at the types of interventions or recommendations that were being made using the behavior change wheel's intervention functions, we found that education was most often implemented, or educational type interventions. And this happened in almost half of the recommendations. And what we found was that about 60% of events were really not being addressed with recommendations that would help to facilitate change. So for example, education was really commonly used as a way to address the safety event that took place. But we know that education type interventions aren't always going to be effective, depending what the underlying source of behavior was. And so this is kind of an example of part of the patient safety program and part of understanding whether or not it functions as a learning health system. And through this evaluation, we can see that there are some gaps in how we're using data and evidence to inform practice. So we clearly have some work to do in terms of actually making sure that when a safety event takes place, that we're using recommendations that are based in evidence to address those safety events and to prevent future events from taking place. And so alongside this first evaluation of the patient safety events, we are also planning to conduct a mixed method study using document analysis, observations, and interviews to further understand some of the other gaps and opportunities in the patient safety program in terms of how it aligns or it doesn't align with the learning health system. So we want to ask key stakeholders who are involved in the patient safety program, look at their policy documents to get a sense of, are they engaging patients in their patient safety program? And are there opportunities for improving this part of the patient safety program so that we can slowly work towards a safety program that is a learning health system. And so we plan to do this sort of at the small scale and work up, scale and spread. So focusing on one aspect of the learning health system, so maybe the data and evidence driven piece, to improve this so that we so that it does better align with the learning health system, and maybe focus on one unit or department. So the patient safety program is across the entire organization. So maybe we want to focus in on a particular department within the organization and try to improve how data and evidence is being used in that department for those safety events that are being reported. And then to work from that and continue to sort of improve the entire patient safety program to make sure it aligns with the learning health system. And so we're kind of doing these two studies at the same time. So with that first study that I talked about, we want to continue to build on this. And now that we know that we have room for improvement in terms of how we use data and evidence in making safety recommendations, we want to try and implement strategies that can improve how we do that. And then at the same time, with that second piece or second study, continue to look at other parts of the patient safety program or other parts of the learning health system to try and slowly have a fully functioning learning health system at the IWK. And really the goal is that the IWK is a tertiary care center that really wants to move towards this learning health system vision or concept. So we're doing all of this to slowly make that transition happen. Thank you, and I'm happy to take any questions now.
Great, thank you. That was an excellent presentation and really, really interesting through from the review to actually putting that into practice. And we have a question that has come in on the chat already, which says, how did you decide on your study design for study 1 and 2?
So I guess for that first study where we were evaluating or trying to understand the current patient safety events, we, I guess, worked a lot closely with some of the patient safety consultants and leaders in the organization. They sort of identified this as being a really important part of the patient safety program that they wanted to improve. So I guess it was sort of working with them and realizing this was a gap that we wanted to address. And then, so I guess myself and my other people in my team who are experienced with the behavior change wheel, we felt that this could be a good framework to use to understand those underlying behaviors and then the actual interventions, because with the behavior change wheel, it's really maps really well onto each other, because we're really trying to understand, are we addressing those safety events with recommendations that are based on evidence? And so the behavior change wheel kind of allows you to do that. So I hope that answers the question for the first study. And then the second study is, so we're actually still in sort of the planning stages of the second study, but just knowing that we have kind of all these key people as part of the patient safety program. So we know that we can get a lot of information from those stakeholders. We can interview them to identify the sort of gaps in the learning health system from their perspective, but then also looking at the different documents, sitting in on patient safety meetings to observe what's happening. And that, I guess that study as well is kind of based on a previous study that our team was involved in, where they also at the IWK looked at how the IWK sort of functioned as a learning health system during COVID. So they're looking at kind of those opportunities for improving as a learning health system using COVID as a case study. So we're kind of doing the same thing with this patient safety program. So they used the same approach. They looked at different documents and they spoke with stakeholders to get a sense of like where the gaps and opportunities are for being, I guess, better aligned with the learning health system.
That's great. And if anyone has any questions that is easier to say themselves rather than putting in the chat, feel free to raise your hand and we can unmute you that way. But the next one that's come in was a person wondering about the size and scope of IWK. So they work in a provincial health authority and often think about what it needs to be adapted in approaches like yours to make them applicable on a bigger scale.
Yeah, and I think that's probably the challenge with this learning health system idea, is that it is always changing, and to do it at that bigger scale, I think does take a lot of effort. And I think you kind of need to start small and build up. At the IWK, it's a great place to start implementing this because it is a smaller organization. Even though they do serve patients from 3 different provinces, it is still fairly small. So for us, it's been really, I guess, easy, I'd say, to get sort of like leadership on board with this idea of trying to move it to a learning health system. And I think that is really important and helpful to get kind of that buy-in to make sure that we can be implementing this across the health system. So yeah, so it might be a very different experience at the IWK versus a different type of health system.
So, but potentially in either place, some of it's around starting small and figuring out what works so that you can expand from there, and small sites can work with that, but it doesn't need to have to be a small site. Great. So the next question thanks you for a very informative presentation and wonders how you identified stakeholders for your sites.
So I guess that's maybe referring to like our second.
Yeah, I think probably with the mixed methods one.
Yeah, so I guess, so this is, as I mentioned, sort of in the planning stages, but again, I guess so there's some people who sit at sort of more that leadership level in that patient safety program. So they're really involved in sort of planning this study. So they would be stakeholders for us. And they've also been able to point us to the right people to include as other stakeholders. So for example, those patient safety consultants who are hired by the IWK, and they are the ones that they have like a dedicated department that they review the safety events for. And so they would be other stakeholders that we would engage with. And then I guess sort of working with them to identify other stakeholders. So maybe it's other people at the team level, like frontline workers who are involved in that team review process. But yeah, I think again, it's just kind of having that buy-in or support from the leadership has been helpful to get them to help us identify the different stakeholders because they sit sort of higher up in that patient safety program.
Yeah, and with these kind of system approaches, it's almost who you talk to leads to the next person that's relevant to be able to talk to with some of those approaches. So the next question, that they really liked your approach of the behavior change wheel and how it maps nicely to the selection of implementation strategies. Can you comment on the assessment of context and organizational barriers and facilitators?
So I guess that something that we will look to more as that study progresses. So in using the behavior change wheel, we essentially had these safety events, which were just documented on paper. So we had a description of the safety event and then the recommendation that was implemented to address that safety event. So we were really just trying to understand, do those match up? So are the recommendations matching up to the underlying behavior? So I guess in our study, we were really just using the COMB and TDF to code the actual safety events and then code the recommendations with the ultimate goal of just seeing, do they align? So I think in kind of the next steps of that work is where we want to now implement things that will help improve this process. And so I think that's where we'll start to look at more of the context and actually see some of the barriers. So like, for example, most of the interventions were educational type interventions. And I am guessing that that's because it's feasible, it's really quick, but we don't know that yet. So because we haven't really, I guess, looked at all of those different barriers and enablers. But I think that's kind of the next step of that work.
Yeah, and education's always that go-to strategy because it's the first one that people think of, but delving in a little deeper to be able to see what other strategies are used and how they connect. So the next one has just popped in. So keep these coming, it's great. So in addition to the stakeholder question, how did you or do you plan to engage patient partners in the learning improvement processes? And an excellent presentation with practical information. So thank you.
Thanks. Yeah, I guess it would be great if we could. So we do have like the youth advisory council and family advisory council. So I guess I envision when we're trying to understand if the patient safety program is aligned with that learning health system, we do want to hear from patients or patient partners to understand if they're involved or not, or how they're involved. But I guess I already know that we don't have a patient partner who sits on the safety discussions each week. I have a sense of how the family council is involved in the patient safety program, and they're really not at the moment. So I think it's kind of tricky because maybe I'm kind of answering our question, but at the moment, I think that is a gap in the patient safety program, is that patients aren't really engaged in the conversation or designing recommendations for safety events. So we'd like to explore that and maybe move that piece of the patient safety program forward as kind of a priority. Yeah, I don't know if I answered the question.
I actually have a follow-on question that ties into to your phase 1 study with the literature review, because you mentioned that the patient engagement piece was a gap and it wasn't really very common. But were there any really good examples where people did include patients and people with lived experience in that process that we can kind of start to look towards in any of that? Was there any good examples?
I think, I don't know, I can't think off the top of my head. I think the example I shared was one of the ones that were more at that engagement level where they actually involved patients in designing the learning health system. Whereas from memory, from most of the papers, it was really just kind of, they implemented the learning health system and then they were collecting patient data as part of their learning health system and then that back into the system. Or maybe patients were involved in kind of like providing their own data before they came to the clinic, and that changed the provider's practice. But I think actually having that really meaningful engagement, I don't remember seeing that come through in many studies. So I think, yeah, there's a lot of work to be done there.
Yeah, so it sounds like, as in a lot of research, there's that patients as part of the, like, as participants almost with the
Yeah.
looking at the data, but not as much on actually engagement side and being involved in thinking through some of these processes. Uh, okay. Okay, so the next question is, have you assessed the adherence of staff to the patient safety program, and how is the culture in the organization? Um, yeah, sorry. I'll start that one again. Have you assessed the adherence of staff to the patient safety program, and how is the culture of the organization? And what tools did you use to measure this?
So we haven't assessed that. Um, so I guess that would be kind of in the next steps of that work, is to continue to kind of understand, like, yeah, how is culture part of the patient safety program? Does that align with that learning health system model? Um, so that's, I guess, coming in future research, but there are some things like having that safety coach program where they train people. There's definitely work being done, I think, to kind of get people on board with being safety advocates, but we haven't done any kind of formal assessment just yet. So that's kind of in that phase 2 study too.
And if I'm remembering correctly, I think there's a review that came out, because the term culture itself and then, like, the climate is a really complex term with a lot of different definitions. But I think there was a paper that came out recently that looks at a little bit of that. So that might be one of the kind of starting points for starting to delve into that, because once you're in there, there's so many different elements. And when you're thinking of learning health systems and the culture and all of these different pieces. Mm. Okay, so keep those questions coming. But for the next one, based on the learning health system review findings, what would be one actionable step or top priority for health systems if they wanted to transition to a learning health system?
I think one thing that came through in the review is that, like, that idea of digital data capture was really common across all the studies. And I think that having that system in place to help you capture that data is really important. So, like, not having an electronic health record system, for example, I think would be a huge challenge in order to actually capture that data in a quick way. So I think that's probably the first step for a lot of health systems, is if you have that in place yet, it's going to be really hard to transition to a learning health system, because you kind of need that system that is a digital system to help you capture the data. So I think that for me really came through in the reviews. Like, all of the studies essentially talked about how they created their electronic health record system or use their electronic health record system to capture the data in their learning health system.
So it's almost like that first step. If you don't have that in place, it's really hard to be able to use that data and have the system to be able to actually incorporate it into your learning health system. So it'd be interesting to see if there are examples of where they don't have that, or that transition of how to actually incorporate that electronic system as you're building a learning health system as well. So, all right. So I haven't seen too many more in the chat, but we've got one. Oh, sorry, one just came in. All right. So they're wondering how long this project has been in the works so far, and if you have any lessons learned or wisdom to share in terms of the speed of change. So there's lots of factors that affect this this timeline, but kind of what's been the progress so far.
So I guess this fellowship is 2 years that I'm part of. So I've been in the fellowship now for a year and a bit. And so I guess the review is where we started with the review, but then while doing that, we started having these conversations with the patient safety leads. So that work with assessing the moderate level safety events have been, I guess, since kind of like January, February of this year is when we started having those conversations. And they're very interested to actually use the findings as soon as possible. So in terms of the rate of change, I think it's been so helpful to have them all on board, and they just really want to use evidence to change and improve their practice. So it's been really it's been a very positive experience so far, just because I think that team they've sort of identified this as an issue, and then I was the one who kind of came in with that research lens and was able to use a framework and kind of give them some really clear findings, and now they really are excited to use those findings. So so hopefully we can actually start implementing or changing the reporting process that they're using to make it more effective, or to help them so that they are making those evidence-based recommendations. Hopefully sort of by the end of my fellowship, we can kind of give them a tangible tool to use, yeah, sort of based on that work.
Yeah, it's a really, really interesting example of that learning health system impact fellowship working really directly in that system. So my last question was just more on some of your experience and knowing that you're coming with that research and that rigor, but then also the people that want these things right away and want to be able to make these changes right away. So how have you been able to navigate that dynamic?
That's a good question. I guess it's hard because research always kind of just takes longer than you expect. But again, I think just having them, like, we work really closely. And so when I brought this framework to them, they're really excited to use it. And then I think just kind of showing those examples of, like, they already kind of knew that they probably weren't addressing their safety events with recommendations that were always working, but they never really sat down and saw it through that research lens, I guess. And so I think now that we can show them that, it's almost just showing how important that evidence and research piece is. And I think they're really valuing that. But it is a fine line, I guess, of trying to move things quickly, but then also doing it in a way that's evidence-based.
Yeah, it's that fine line and the relationships, I think, along the way that you mentioned at the beginning around keeping that moving. So I think that's a great place to stop, unless you have any closing remarks that you wanted to end on. I'll pass over to Megan.